Welcome to the Healthy Aging channel. I'm excited to join you on your journey to better health, especially as we reach middle age and beyond. At this stage, taking care of our brain health and maintaining memory is incredibly important, as natural changes in our body and external factors can significantly impact the quality of our lives. Today, we'll explore a topic that's not new, but often overlooked: anticholinergic drugs and their impact on brain health, especially regarding memory loss. Memory loss is not just a natural part of aging but can sometimes be a warning sign of cognitive decline. This is a growing issue, not only in older adults but also in younger people, influenced by lifestyle, health conditions, and factors such as medication use. One such factor, often overlooked but with significant impact, is anticholinergic drugs. These are commonly prescribed or used to treat issues like insomnia, pain, allergies, or bladder problems. However, few are aware that prolonged use of these drugs can have unwanted effects, particularly on memory, cognitive function, and concentration. While this may not be a new topic, the lack of awareness has led many to unknowingly put their brain health at risk. In today's video, I'll share with you what anticholinergic drugs are and how they work, why they are linked to memory loss and the risks they carry, how to recognize and mitigate the negative impact of these drugs on brain health. If you, your family, or loved ones are using these drugs, this is a video you don't want to miss. The information I'm about to share will not only help you understand the effects of these medications but also provide practical solutions to protect memory and maintain a high-quality life as we age. Let's dive in and explore now. Part 1. What are anticholinergic drugs and how do they affect memory loss? To understand the impact of anticholinergic drugs on brain health, especially memory loss, we first need to know what they are. Anticholinergic drugs are a class of medications that inhibit acetylcholine, a neurotransmitter critical to the brain and nervous system. Role of acetylcholine in the brain: acetylcholine is like a conductor in the nervous system, helping transmit information between nerve cells. It plays a central role in many important brain functions, including memory, helping store and recall information; learning, facilitating the acquisition and processing of new knowledge; focus, maintaining attention and effectiveness in tasks; muscle control, regulating muscle activity. Effects when acetylcholine is inhibited: when anticholinergic drugs inhibit acetylcholine, brain signals become disrupted, leading to a range of negative outcomes. These effects not only make daily activities more difficult but also increase the risk of memory loss and other serious cognitive problems, such as memory loss, difficulty recalling information or storing new memories; poor concentration, disruption of neural transmission impairs focus and attention; slower thinking, thoughts may become foggy and sluggish; higher risk of neurodegenerative diseases. Long-term inhibition of acetylcholine may increase the risk of Alzheimer's disease, dementia, and other neurological disorders. Studies have shown that people who frequently use anticholinergic drugs have a higher risk of memory decline compared to those who don't. This condition often starts with mild symptoms such as forgetfulness, difficulty concentrating, and can progress to dementia if left unchecked. This is especially concerning for older adults, as the brain naturally produces less acetylcholine with age. When combined with anticholinergic drugs, the negative effects become even more pronounced. In the next part, we'll take a closer look at common anticholinergic drugs and why they often go unnoticed despite their significant impact on brain health. Part 2. Common anticholinergic drugs that contribute to memory loss. Many of the familiar drugs we use daily can either cause or worsen memory loss. These medications are typically used to treat common health issues but have potential side effects that impact the brain and memory. Here are some common categories of drugs to be aware of. 1. Antihistamines that cause drowsiness. Examples: Benadryl, chlorpheniramine, O function, typically used to treat allergy symptoms, colds, or itching. O impact on memory. These antihistamines not only reduce allergy symptoms but can also cause drowsiness. They can impair short-term memory, especially with long-term use. Inhibiting acetylcholine can decrease your memory capacity. 2. Painkillers combined with sleep aids. O examples: Tylenol PM, Advil PM. O function, often used for pain relief combined with insomnia. O impact on memory. These medications combine acetaminophen, or ibuprofen, with diphenhydramine, an antihistamine. While they help with pain and sleep, diphenhydramine can inhibit acetylcholine, increasing memory loss risk, particularly in older adults. 3. Drugs for overactive bladder. O examples: oxybutynin, ditropan, tolterodine, detrol. O function, used to treat symptoms of overactive bladder, like urgency or incontinence. O impact on memory. These drugs can cause cognitive and memory issues, especially with long-term use, which clearly shows how medications can affect concentration and recall. 4. Anti-nausea or dizziness drugs. O examples: meclizine, Antiver. O function, often used for motion sickness or nausea. O impact on memory. While meclizine helps with dizziness, it can also impair concentration and memory. This effect may cause difficulty maintaining long-term focus. 5. Antidepressants and neuropathic pain medications. O example: amitriptyline. O function, used to treat depression, neuropathic pain, and other mental health disorders. O impact on memory. Amitriptyline is a tricyclic antidepressant, TCA, that inhibits acetylcholine, reducing memory function and causing memory loss in long-term users. 6. Muscle relaxants. O example: cyclobenzaprine, Flexeril. O function, often prescribed for muscle pain or spasms. O impact on memory. This medication can cause drowsiness and cognitive impairment. Side effects like dizziness and fatigue can hinder concentration and memory. 7. Special antidepressants. O example: paroxetine, Paxil. O function, a potent antidepressant that inhibits acetylcholine. O impact on memory. Paroxetine can directly affect memory and thinking, leading to memory loss and concentration difficulties, especially for long-term users. While these drugs can be effective in treating health problems, prolonged use may lead to serious cognitive issues. It's important to be aware of their side effects and discuss alternative treatment options with your doctor if necessary. Always weigh the benefits and risks, especially if you're in an age group that is more vulnerable to memory problems or brain-related conditions. Part 3. Who is at risk for memory loss from anticholinergic drugs? Although anticholinergic drugs can provide short-term treatment benefits for many health conditions, they pose serious risks for certain groups. Understanding who is most affected can help you take proactive steps to avoid these unwanted side effects, particularly related to memory loss. Below are the groups most vulnerable to the negative impact of anticholinergic drugs. 1. Older adults. O impact on the brain. As we age, our bodies naturally produce less acetylcholine, a key neurotransmitter for maintaining memory and brain function. Acetylcholine is vital for memory, learning, and staying alert. Why they're affected. As acetylcholine levels decrease, the brain becomes more sensitive to the effects of anticholinergic drugs. Using these drugs increases the risk of memory loss, cognitive decline, and even diseases like Alzheimer's or dementia. 2. People with existing memory problems. Cognitive decline. Those already experiencing mild cognitive impairment or memory loss often have more vulnerable brains and struggle to cope with the effects of these drugs. Anticholinergics can make these issues worse. Why they're affected. When memory problems are already present, using anticholinergic drugs can cause more rapid memory decline and accelerate neurodegenerative processes. 3. Those at risk for Alzheimer's or dementia. Increased risk. Studies show that long-term use of anticholinergic drugs can raise the risk of neurodegenerative diseases like Alzheimer's or dementia. If you have a family history or other risk factors for these diseases, using such medications can worsen your condition. Why they're affected. If the brain is already vulnerable, adding drugs that inhibit acetylcholine can impair thinking, attention, and memory, leading to more severe memory loss and increasing the risk of Alzheimer's. If you belong to one of these groups or have a family member using anticholinergic drugs, always consult with a doctor to understand the medication's effects and explore safer alternatives. Being cautious with medication use will help reduce the risk of memory-related side effects and protect long-term brain health. Part 4. How to reduce the risk of memory loss from anticholinergic drugs. If you or a loved one is using anticholinergic medications, you may be concerned about their impact on memory and brain health. However, there are several steps you can take today to minimize the risk and protect your memory. Below are some suggestions to help reduce the negative effects of anticholinergic drugs. 1. Check the labels. Read the labels carefully. Always read the labels of any medication before use to identify potential side effects, especially those related to memory loss, difficulty concentrating, or cognitive disorders. Look for the term anticholinergic. If you see terms like anticholinergic or acetylcholine inhibitor on the label, it could be a sign that the drug may affect your brain function and memory. 2. Talk to your doctor. Ask about alternative options. Don't hesitate to discuss with your doctor if you're concerned about the effects of anticholinergic drugs. Request guidance on alternative medications with fewer side effects on brain function and memory. Reduce the dosage. If your doctor allows, you may need to reduce the dosage of the medication or change the way it is taken to minimize its negative effects on memory. In some cases, switching to a different medication may be necessary to protect brain health. 3. Try natural solutions. Lifestyle changes. One effective way to reduce the risk of memory loss is by changing your lifestyle. Focus on a healthy diet, regular exercise, and getting enough sleep. Improve your sleep environment. If you're experiencing sleep problems, try improving your sleep environment. This includes reducing light, noise, and ensuring your sleeping area is comfortable to help you get deep, restorative sleep, which is beneficial for memory. Practice yoga and meditation. Yoga, meditation, and relaxation exercises can help reduce stress, improve blood circulation to the brain, and promote mental well-being. 4. Enhance brain care. Brain healthy diet. A balanced diet plays a crucial role in protecting brain health. Include omega-3 fatty acids, such as those found in fatty fish, salmon, mackerel, and berries, like blueberries and strawberries, to improve memory and protect brain cells. Regular exercise. Physical activity is not only good for the body but also helps improve blood circulation to the brain, boosting memory and focus. Try walking, swimming, or participating in your favorite sports. Mental exercises. Just like the body, the brain needs exercise to stay flexible. Engage in intellectual activities such as reading, learning a new language, or playing puzzles and games to stimulate your mind and improve memory. Do not stop using medication without the guidance of a doctor. While natural solutions and lifestyle changes can help protect your memory, any changes to your medication should be made under medical supervision to ensure safety and treatment effectiveness. Memory loss is not just a result of aging. It can also stem from factors that we may not fully recognize, such as improper medication use. We often think of memory loss as simply part of the aging process. But in reality, many external factors, such as medications, can accelerate this process. Anticholinergic drugs, while providing short-term therapeutic benefits, can negatively affect memory and cognitive function. Therefore, it's crucial to understand the impact of these medications and use them responsibly. Remember, the key to maintaining a healthy life and sharp memory is understanding and making informed choices. By reviewing the medications you're using, consulting with your doctor, and making positive lifestyle changes, we can protect our memory and brain health in the long term. If you found this video helpful, don't forget to like, share, and subscribe to the Healthy Aging channel for more useful information. Thank you for watching. Wishing you good health and abundant energy. See you in the next video.